Hi, my name is Dinesh Simakirti, and I'm the CEO of Stasis. You're here today for another fireside chat with Dr. Aruna Ramesh, from Ramaiah Memorial Hospital. She's a professor and head of medicine of Ramaiah Memorial Hospital and is a program director of Heart Rescue India. She has received an honorary commanding officer for casualty services from the government of Karnataka and has now practiced for 26 years. We're really excited to talk to her about her experience in emergency medicine. Ramaiah Memorial Hospital has always been an early adopter of medical technology. Can you share some of the other initiatives that you guys have been taking?
Sure. Ramaiah Memorial Hospital, I can say, has been a first in many things. And probably in 2004 itself, we had established the accident and emergency services. So that's one of the first in Bangalore, probably in the state.
Wow.
And we have a full-fledged department running since then. So the support of the management and also the institution has led to us developing skills of across the healthcare workers. That is by utilizing the services and also facilities available at the Advanced Learning Center. That is called as the Ramaiah Advanced Learning Center. So at this center, across all levels of care, of healthcare, and also all levels of specialities, there is a simulation training program available for us, along with the cadaver facility that is available. So at the Advanced Learning Center, the technology has incorporated the latest, utilizing the simulation and also the basic facilities where you need to do a hands-on for a surgeon using the cadavers. So this has been integrated and provides a platform where the OT simulation is done as real time, and also using mannequins, we can simulate patients and patient physiological events. So what Stasis is doing on the patients over here, we will be able to show that and replicate and also reproduce the events, adverse events that occur over here on the mannequins over there, and ask the healthcare workers on how better they can perform or how they would have done it differently if they had identified such an event, so that we can prevent medical errors or minimize medical errors that occur in future. So it gives us a platform for developing her skills, and also it gives a platform for us to train healthcare workers without actually training on the patients.
Wow, that sounds great. I would love to get a tour.
And it is going to make an impact because we are doing the National Task Force project especially in comprehensive trauma care and registry development. So we have been chosen, Ramaiah Medical College and Hospitals has been chosen along with Memorial Hospital to be one of the key players, and we will be coordinating with 2 other centers to ensure that the skills development and trauma care is provided, and probably utilizing the Stasis monitor and showing and how useful it is going to be in the continuous monitoring system in these patients who come with trauma injuries.
Well, thank you so much for that. So Dr. Aruna, you are actually the principal investigator for 2 projects in both heart attacks and road traffic accidents. Can you share more about those?
Yeah, one is an international project we are doing to see on how we will be able to provide immediate care to heart attack victims. This is an add-on to the STEMI project that is already ongoing in India. So this is called as the Heart Rescue India project, which we are doing along with the University of Illinois, which is supported by Medtronic and RTI. So what we are trying to do is adapt the hub and spoke model that is recommended by STEMI, but we have modified it so that it can become applicable to all over India. So if people can adapt it, we can show them that it is a workable model. Probably the private sectors can contribute to the government and ensure that these victims, young victims who die between the age of 25 to 60, lead a productive life, reach the government hospitals also, especially in patients who cannot afford reach the government hospitals in time to get interventions done.
So
road traffic injuries also is an issue of patients reaching the hospital and giving adequate treatment. So if you look at both of these, it is the parameters that matter, the vital parameters and the actual real-time documentation of these parameters. That is necessary for us to implement and ensure that we get it, so that we can validate the values that we get following the project completion.
So it's, you have kind of two issues here. One, how do you get the patient to the medical personnel across the city or across wherever the heart attack or road traffic accident happened? But also, how do you get the information to them, ideally faster, so that the doctor can kind of assist in during the transit even?
That's true. So that you can have an one-on-one conversation or telecommunication with the team that is the pre-hospital team that brings in the patient.
Exactly.
Okay, once the patient is brought in, we might have to transfer depending on the different levels of care that is available across the state. So this patient might have to be transferred to a higher level of care of hospital. So during this transit time, so that you will know and guide the patient transfer, and even the receiving hospital will be able to coordinate with this team, and probably in some areas where you will not be able to reach through telecommunication, we will be able to guide the team who has the expertise but might not have the knowledge to give the necessary care that is needed in that hour of
Definitely.
need.
Yeah, it's a very critical hour.
Yeah.
Well, thank you so much for all your time, Dr. Aruna. This was extremely helpful to hear your thoughts and your experience in healthcare. Done a lot in emergency medicine.
Thank you so much for giving us also an opportunity. Yes, here is an area that we need to build and work on. Only thing is that we need to look at is, as you go by, how you can bring the cost down so that it can be accessible from the PHC to the district level hospitals across the state. That will be a dream.
Exactly. Our goal is to be in as many patients and help as many people as possible.
Right.
Great. Thank you.
So good. Nice.